made some progress, but why so late and such difficulty? Is art really a priesthood which demands that the pure in heart belong to it entirely? The great masters knew how to fuse their personality with everything that lay before them, how to animate everything with their passions. I can't do that because I want to be true. I want to tear the truth from everything. I want reality in its entirety. I want to reach its very soul. There's a logic.
Tonight, we enter the world of art therapy and healing through creativity. Historically, early psychiatrists saw the use of art to assist the analyst to gain further insight into the patient's problems and progress. In the 40s and 50s, art therapists provided art instruction to patients in mental hospitals. It was hoped that the patients would develop an outlet to express emotions in a non-threatening way. Well, in the 1960s, art therapy became a therapeutic discipline in its own right, and art is now used to produce growth and change. It is both art and therapy. Jane Rhine, author of The Gestalt Art Experience, makes this statement, that each time you and I draw, paint, or model, we are actively living through an event, our own experiential event. As the lines and shapes emerge from our activity, we can observe how we are forming a visible, graphic record of something we perceive. We have a tangible record of our personal reality. We are fortunate to have with us Barbara Allen, an art therapist and chemical dependency counselor. I want to welcome you, Barbara. Thank you for coming today.
You're welcome.
I was intrigued with our opening clip where that was of, excuse me, Paul Cézanne, and quotes him as saying, being confused about the art as a priesthood. And you know, one of the thoughts that people have about art and artists and the use of art is that somehow it's something foreign. There's something about it that's kind of otherworldish, that sets artists apart from the rest of us. Has that been your experience?
And it's for other people.
And it's for other people, that's right.
We're all born creative people, and someplace along the line our creativity is shut down by parents who say you didn't stay within the lines, or teachers who say leaves on trees are green, not purple, what's wrong with you? And so at a very young age, creativity is shut down, unfortunately. And yes, I believe that the true artists are considered in a world apart.
Okay.
Although I believe that we're all true artists, but the ones that the world has given a claim to.
Okay, so maybe there is some special vision there that they possess. Now, we looked at historically the fact that art is, or has been used at this point to create therapeutic change in people. And I'm curious about how you became involved in using art therapy.
I was referred to an art therapist by a psychiatrist as my marriage of 20-plus years was falling apart.
Okay.
And I painted with her. This was Harriet Parker. Painted with her for 3 years. And then ultimately, as I was recovering from the hurts and what have you, I developed my own program to help other people. It's nothing like what I did with Harriet.
Okay. So you have had personal experience of healing as well as teaching others.
Right.
You had brought with you, and I have them here, at least one of them, a booklet that you produced, Skies Are Not Always Blue and Trees Are Not Always Green. Can you tell us a little bit about this workbook?
There are exercises in the book that have to do with painting your feelings or painting your experiences. Okay. I work a lot with feelings. People have stuffed their feelings and drugged them a lot of times for so long. It's really important to get them out.
So the theory is that we can express through creativity, through art, things that we maybe cannot put into words. Maybe there are feelings we have that defy being caged by verbalization.
That's really true. Painting, there are many forms of art therapy. I'm really into painting. Painting is the one that is the art form of art therapy that exercises the right brain more than any other.
And what can you give us some characteristics of right brain?
Right brain, intuitive, allowing our creative selves to come forth. Intuitive, you know, the stuff that's buried deeper that we don't usually share.
So maybe an appreciation for the more abstract things. Okay. Well, I know you brought some examples of art with you, and I'm wondering if we could take a look at them and you can share a little bit about them with us. Let's take a look at the first. This particular piece of art, can you tell us a little bit about its origins and what it represents?
This painting was painted by a 25-year-old woman who had been raped, and when the baby was born 9 months later, the baby was stillborn, and of course she was carrying around all the hurt, depression, and anger that went with that experience. And in painting this, it allowed her to be able to talk about it.
So the heart represents the child, the loss of the child? Or?
The uterus, and also the love that a child would have had.
Okay.
Black's the depression, and the rapes involved in that.
Okay.
The red up there is the anger.
Now, was this person receiving traditional talk therapy in addition to doing the painting work with you?
She had had some and mostly abandoned it, and she just happened to come and paint with me.
Okay, and in the process got some healing. Okay.
Right.
Let's take a look at another choice and see what else you may have brought us. Oh, no, this is interesting. What can you tell us about this?
This was painted by a 25-year-old Mexican-American who had a really bad eye infection, and this is a painting of the pain in his eye. And you can see all the different parts of the eye that are involved in that. Red hot pain.
Yeah. Now, in the process of painting this, did this person receive some relief emotionally, or how did this work for him?
There is relief from pain in painting the pain.
Okay.
You know, you paint the pain in your neck and shoulders, and it is alleviated. Sometimes it's even gone. And he received some relief from the pain in his eye.
Okay. So it sounds like, do you do this in terms of courses or classes, or do you work with people one-on-one?
I do one-on-one, I do workshops, I work with larger groups. I've worked with a group of 30 women at the American Women in Psychology Conference one year in Oakland. I was invited.
Oh, you did art therapy with therapists?
Right.
Oh, that must have been a scream.
It was wonderful. It was really good.
Oh, okay. I know sometimes it's hard for us as therapists to be willing to openly express whatever's lurking down in there. We have a lot of pressure sometimes to be perfect or to
yeah, and
feel
are
like
we
we're
really going to share of ourselves?
That's right. Well, good for them. They were brave enough to do it. Okay. In terms of your own life, are you continuing to use art as part of just ongoing personal work?
For me, yes. Not as often as I'd like to. I've gotten very busy in the last couple of years. I do usually paint when I paint with when other people paint with me, whether it's an individual or a group. I usually paint. I'm amazed at some of the things I get in touch with as that process goes on, and sometimes I just shut it down because of necessity.
Have you ever been surprised by something you discovered in your work, or in your work with other people, things that they weren't aware they were even feeling, and then in this process it showed up?
I was painting the pain in my neck and shoulders one day. I have degenerative arthritis. And guess who showed up in my neck and shoulders? My mother.
How about that?
And that was a very revealing experience.
Yeah.
I'd had a bad relationship with her all my life, but here came Mama in my neck and shoulders when I was painting the pain.
So it gave you another direction, maybe where you could channel your energy.
Right.
Okay. Let's take a look at a couple more of the paintings you have brought to us. Oh, now this is interesting also.
This is
what can you tell us?
Excuse me. This is the same young Mexican-American. He painted a picture of an orgasm.
Oh.
And I've always really liked this. I think it's very expressive and very interesting.
What was going on with him in general that would make him have a desire to paint an orgasm? I mean,
I'm not sure.
You're not sure? Okay, you just decided that was what he wanted to do.
Right.
How about that?
Isn't that a wonderful painting?
Actually, it really is. It's very powerful.
Yeah.
Okay. You mentioned that you think all of us are born creative. that we all have that part of us that is expressive and that maybe does get shut down over time.
Right.
What that makes me think of is my 4-year-old nephew. I have some paintings, finger paintings done by him actually in my office that I have hung up on the wall. And the combination of colors and styles. At what point do you think we lose that? Because at 2 or at 3 or 4, he doesn't have the vocabulary we have. So it's almost like he has to express it in that form. I mean, how soon or at what point do you think we really do begin to feel like we can't do that anymore?
I think when we're criticized or we hear others criticized about their artwork. I think it happens so often with young children, Mary, that you didn't stay within the lines. Let me show you how to do that and make it a little better, type of thing. I've watched this go on with one of my grandchildren to the point where his creativity was shut down for a while. I think his father finally became aware of what he was doing, and so he's doing better now. Doing his own thing now. I don't mean better.
Right. Well, when I was doing a group the other day, I do a women's identity group. And we had some clay, and we were all going to be modeling our inner goddess, and or something that represents kind of that inner female power that we have. And it was interesting. Everybody went around, and as we talked, they were doing that. And we did have one woman who made a couple different attempts and then just sort of squashed her clay together and said, "I can't do this. It's not perfect. It's supposed, what I'm trying to make is this goddess head." I guess she had this picture of this famous art piece, and because she couldn't do that, she squashed it all up and said, "I'm not doing this." And the discouragement was there, and I have to say that at some level, it seemed to me that she seemed in that moment very young. I could picture her being a first grader and squishing up her tree and saying it's not the right tree and putting that away. So that perfectionism that you're talking about was there very, very strongly with her. We're going to take a break, and when we return, we'll learn more about accessing our creativity for healing. Stay tuned. Thank you for joining us. You caught me mid-sentence, didn't you? We're going to go back and take a look at a few more art pieces and generate some more discussion. Let's take a look at this.